So we're going to talk, I'm going to basically set this up for the pathologist to give you the good stuff. So ionophores are, for those of us who are maybe not familiar, it's a new, fairly new class of drugs. It's actually an antibiotic and used exclusively in food animals. Its label claim here in the U.S. is to improve weight gain and feed efficiency. There is international acceptance of ionophores, so it makes them attractive for producers all over the world to use them. There's different types of ionophores: monensin, lazuloside, seleniamycin, and narasin. Narasin has been approved in over 20 countries, but it's the only one approved for use here in the U.S. And it has a 0-day withdrawal and doesn't require a VFD. So those are some attractive points for the producer. And a couple other things that have been reported in the research that you won't find on a label anywhere. And one is that in a case of TGE in Canada, they put monensin in the sow feed, and that was found to reduce pre-weaning mortality. And a recent study presented last year at AASV showed that pigs, nursery pigs that were fed narasin had lower shedding of the PD virus. So those are some other benefits and interests to the swine producer that they may take into consideration before they use an ionophore. So specifically, since narasin is the only one approved for use in the U.S., I'm going to speak about what you should know about using it before you put it in your swine herd. Like I said, it was the only one approved by the FDA. Its trade name is Skysis 100, and again, it's sold by Elanco. The label has a very specific cautionary statement that swine being fed Skysis should not be fed pleurometillins. So what is a pleurometillin? Denagard. So thiamulin is specifically is the one that we're concerned about in the U.S. And those can cause some pretty nasty reactions that's been reported in the literature, and obviously if those reactions occur, you want to remove the feed. So 2 cases that have been reported, one of potentiated toxicity, so this where ionophore had unintentionally made it into the feed, and pigs were either being fed Denagard or they were being administered Denagard through the water. So in either delivery of thiamulin, you can see this potential toxicity occur, this potentiated toxicity occur. Excuse me. So the other thing is the safety margin. There is reported in the literature 45 parts per million, 1.5 times the dose. You get higher than that, and they have reported in multiple different species clinical signs of ataxia, recumbency, weakness, and dyspnea. So a little bit about my case specifically. July 28th through August 10th, 2014 was the time period where we counted these animals. It was a finishing farm, 8,040 head barns in the Oklahoma Panhandle. They were multi-sourced by site, single sow sourced by barn, all in, all out by site. The pigs affected were 19 weeks in age, or 19 weeks old. So they were 10 weeks in phase when I was contacted by the producer. Herds, PRRS, flu, myco-positive. They were given a circo-myco shot at weaning. And the total mortality leading up to the event had been very low, well, within production parameters, 0.5% to 4% on the site. And the affected barns, you can see here, were all less than 2%. And so they had just, because of where they were in phase, they were finishing up their phase 2 ration, which is 125 pounds of the second finishing ration that contained 30 parts per million of Skysis, which is The 125 pounds would be the, at minimum, 4 weeks of feeding schisis at the 30 parts per million, which is the label directions. So, what do I need to do? Just click it? Okay. So, like I said, I was contacted on I was actually contacted on July 29th. The clinical science had started several days before. I was contacted by our production manager, and this is what I saw. If you can see that lesion there on the pig's neck, speaks specifically about that. All right, so we talked a little bit earlier that high doses can cause ataxia, recumbency, muscle weakness, high doses of schisis. So knowing that these pigs were on schisis, that was obviously on the top of my differential list. So I just wanted to review what we saw in the first few days of this event. Feed refusal, the average daily feed intake actually had decreased in those barns by 2.7 pounds. The pigs were gant, they were ataxic. Obviously you saw that here in the video, the dog sitting recumbency. They vocalized as if they were in pain, shaking tremors, and I pointed out that lesion, if you could see it. It was a focal area of necrosis on the skin. That is consistent in the marking that was on that pig's back, because the folks at the farm had seen these gant pigs with some respiratory signs. They'd treated pigs in that barn with Baytril, and so we believe that that is a reaction to the Baytril injection. Obviously, that's not reported anywhere in the literature that there should be any interaction between those two drugs, so really don't know what that relationship is, just wanted to point that out to you. And it was only observed in pigs that had received Baytril. What we didn't see was paddling, nystagmus, or response to antibiotic therapy. So obviously quickly moved infectious diseases like strep suis and HPS to the bottom of my list. Only thing else I wanted to point out, clinical signs varied quite a bit. 8.5% all the way to 20% of pigs were affected with a variety of those clinical signs. So before I took any samples, I contacted the diagnostic lab. That's very important in any type of case, especially these potential toxicosis, so we make sure we get the right tissues that are going to help us get a diagnosis, so we obviously don't have to go back. So tissues I did take fresh and formalin fixed, standard tissue set, lung, liver, kidney, lymph node, tonsil, and intestine. I would recommend you take either brain or a brain swab, obviously, to just rule out that it's not CNS or a strep suis or HPS. And I also took a number of muscle tissues. Like I said, I contacted the diagnostic lab before I pulled these, so I just didn't randomly choose these muscle tissues. This was what Dr. Rossa asked me to take. So esophagus, diaphragm, shoulder, ham, loin, heart, and tongue. Also took a blood sample to do serum chemistry, and then multiple feed samples. And there was quite a variation between the feed samples that we pulled, from 220 grams per ton all the way to 587 grams per ton that was found in the feed samples of schisis. So our diagnosis was that it was an acute ionophore toxicity due to a broken load cell in our feed mill that resulted in the addition of 12 times the recommended inclusion rate of schisis. So we did this. True idiopathic or iatrogenic disease here. Treatment, Like I said, they'd already attempted antibiotic therapy. Obviously, that's not going to work. So we quickly removed the feed from the barn immediately, and removed it from all the feeders. Not just vacuumed the bin, but obviously removed it from all the feeders. We replaced it with just a plain corn and soy diet with no antibiotics or any other feed additives, and that's what those pigs ate till marketing. Obviously, we discontinued antibiotic therapy. It was quite concerning to see some lesions develop, obviously in the case of that Baytril injection that we didn't expect, so we didn't want to take any chances that there was potentially some other potentiated interactions that could occur. We minimized excitement and stress by very few people in the barns, only the manager walked the barns, and to identify pigs that obviously couldn't get up to feed and water and get those euthanized based on our welfare and euthanasia policy. So the outcome for us, I would call it a moderate recovery period. Within 7 days, there was no new cases. And within 14 days, all the pigs had recovered or unfortunately had to be destroyed. Obviously, so increased mortalities, what we saw, averaged 20% in the affected barns versus 4.5% in the unaffected barns at closeout. I attributed 85% of the mortality in those affected barns to the actual toxicosis event, and 75% of that was euthanasias because animals were unable to get to feeder water. And we did note that the severity of the mortality correlated with the severity of clinical signs we saw initially. Poor growth performance, obviously, I told you that the pigs had been observed raking feed out of the feeders, and pigs are smart. They knew that there was something wrong. I mean, they knew before we did, clearly, because they started raking it out and they backed off, and so our closeout weights were 8.8 pounds lighter than the unaffected barns, and we lost 0.4 pounds in feed efficiency.